So as Kate said, this will sort of move us nicely into our knowledge burst today, where we're going to talk a little bit more about requesting early intervention and special education services in general. So sort of thinking in this case, both boys, because they're in sort of different age brackets, there's slightly different processes for some of these services, and we're going to try to touch on how to get access to some of those supports. So just to start off, we kind of want to cover what are some of the early signs that your child might benefit from early intervention or perhaps later on special education services. So difficulties adapting to classroom routines. So thinking about this little 30-month-old, we didn't get a lot of information necessarily about what it looks like at his daycare, other than that the behaviors have been pretty intense to the point where, he's maybe at risk of not being able to keep attending there. So that would certainly be a sign that he's, not really falling into some of the same routines probably at that daycare as his same age peers. And so that might be something we would notice as sort of a sign that he might benefit from some support. Frustration with communicating wants and needs, which we talked about quite a bit, that might be driving some of those really extreme behaviors. He doesn't have a very effective way of letting anyone know what he wants right now. And that can often, behavior is a method of communicating. And so it seems like that's become, one of his primary ways right now, but not really in a functional way. Limited interest in peer interaction. We heard a little bit about, his brother in this case. Again, sometimes hearing more from a daycare or preschool can be really helpful too, to sort of know what that looks like in the school setting. Does he follow along with some of his peers, or is it a very similar kind of interaction to what the family sees at home, where he's just sort of taking toys and things like that? Another sign would be fixation on objects rather than functional play. So where we might see, not necessarily using toys in the way that they're intended, or being hyper focused on certain items, that might be a sign that, we want to look into things a little further. Transition challenges, which we also didn't really touch on, but it would be helpful probably talking to this family a little bit about, how does it go when he's dropped off at daycare each day? What's it like when he comes home at the end of the day? What if something changes for the routine? And then sensory sensitivity, which we certainly saw some signs of in this case, with the clothing, wanting to be naked and sort of not liking to have anything touching his skin. So this is clearly like a non-exhaustive list, but some good examples of certain signs that we might look for when we're thinking about a child that could benefit from early intervention. So this slide, I think particularly for the family we're talking about today, where this is all very new, but really for any family, there are many, many acronyms that get thrown around, lots of terminology, lots of, unfamiliar words. And I think on top of already being overwhelmed trying to support your child, that can really be confusing and frustrating. These are just some of the many acronyms that you might come across when we're supporting an autistic child. And the one highlighted in red, IDEA, is one that we'll sort of talk a little bit more about today. This is federal law that really helps to guide a lot of what we're talking about in terms of early intervention and special education, and what things are entitlements for children who have qualifying disabilities or needs. So what is IDEA? So this is the Individuals with Disabilities Act. And this is a federal law that's ensuring services for children with a qualifying disability. And so this really means that, every child is entitled to what we would call a free, appropriate public education. And that's, again, another acronym that you may see written down or mentioned. And this basically means that, any child who is actually of any age, starting at birth, but particularly as they become school age, they're going to be entitled to educational services to meet their needs. And this means they can't be excluded, based on developmental delays, based on communication needs. Those are all things that need to be provided for and supported through the education system. And so one part of this federal law is the birth to 3, which when you're hearing us say early intervention, that's what we're really referring to. And so this is more of a kind of home-based focus where we're really looking at that early childhood development and what the needs might be. And then when a child turns 3, they're still protected under this federal law, but from 3 all the way through 21. And right now in Pennsylvania, that's actually been increased to age 22 right now. A child might qualify for special education services to help support their needs. So what is early intervention? Again, this is a term, kind of an umbrella term that we use to describe the different services and supports that might be provided for babies and very young toddlers who have a whole variety of different developmental delays and disabilities. And so sometimes a child might be born with a known condition or a known disability, and they might begin receiving early intervention services almost immediately because, there's sort of a known pathway. But in a lot of cases, like the family we're talking about today, and often with autistic children who aren't going to be diagnosed right away, we really don't notice some of these delays until they get into those early toddler years, and we start to see that they're having, delays in certain areas and perhaps not meeting the same developmental milestones that their peers are, maybe having some frustration and some behavior issues. And so these early intervention services can really include a whole variety of different types of things. So speech therapy, occupational therapy, and physical therapy are really some of the most commonly offered services, but there are other types of supports based on what the specific needs of that child are and the needs of that family. And this, again, is a really sort of family-centered approach that should be looking at all of those early developmental needs. So early intervention services, because of that, typically take place in what we would call the child's natural environment. And many times that's going to be their home. For a child like our case today, where he's spending a good part of his day in a daycare setting, some of those services might potentially happen in that daycare setting, but the family really should be involved in all parts of the process, learning strategies and learning different techniques and things they can work on with their child. So these EI services are all going to be outlined in what's called an Individualized Family Service Plan, or an IFSP. So that's just sort of a way to document what are the things that this child's going to qualify for, how often should they get those services, and what are some of the goals that we're working on, the things that are important to the family. And so I know we have some participants today who joined from other states, but every state should really have a somewhat centralized way of getting connected. So this slide shows for Pennsylvania, there's a Maine Connect helpline. And one thing to note too is that in Pennsylvania, all of these services are free for children who qualify. Other states, so New Jersey and Delaware, who are, in our general area here, they do have some sliding scale copay associated with some of these services. So each state you're going to want to look into and kind of know what the process is in your individual state, but there should typically be a centralized place to start. The evaluation and determining eligibility is going to be free for families regardless. And then once sort of services are proposed, families should be made aware of any cost that's associated and what that's going to look like for them and sort of how to move forward with those services. And so then again, when someone turns 3 all the way through 21 or 22, if they continue to qualify, this is going to be considered special education service at this point. So that same law we were talking about is going to apply to school-age children with disabilities, entitling them to a free and appropriate public education. Another term that families often hear is this idea of least restrictive environment. And so that means that to whatever extent is appropriate and possible, all children should be educated, with their same age peers in the most typical setting that makes sense for them. So, and that's going to look different really depending on the child and depending on what their support needs are and what kinds of services they might be getting. But this basically is saying that all public schools and public charter schools have to support children with disabilities by providing certain special education services. Another place where things can get a little confusing sometimes is that to determine what that looks like, a child does have to go through an evaluation through the school team or the school district. And so sometimes families, it's very overwhelming. They may have just gone through, for this 5-year-old, for example, an evaluation where he got an autism diagnosis, and now they're going to be asked to go through another evaluation to determine what kinds of services he might be able to get through the special education system. So it's just important to understand that, unfortunately, that is sort of the process, because we're looking at really different things. One is a medical evaluation and one is an educational evaluation, sort of looking at what are the supports and what are the services that this child's going to need to be successful in the academic and educational setting. So thinking about sort of what that process looks like, there's different steps to that. And, we'll go through some of that information, but it can be very detailed. So first, we're going to sort of be identifying that we might have a delay or a need here. And then that evaluation we just talked about. So that's going to determine, does in fact this child meet the criteria? So having a diagnosis doesn't automatically make you eligible for special education services. In most cases, we find that autistic children will qualify for some type of special education, but that's not an automatic. So that evaluation is really going to determine what are those needs, what areas does this child need some additional support. And once they are determined eligible, then we're going to develop the IEP, the Individualized Education Program. And this is really what it sounds like. It should be very tailored to the needs of that individual child and should include all of the different kinds of services and supports they're going to need to continue making progress and moving forward toward goals. And then you're going to sort of provide those services, monitor progress. And if certain services aren't working or we're not seeing that a child's making the kind of progress we want, then we go back and sort of reassess things. And as part of all of this, there is a timeline for reevaluations. So families can request a reevaluation at different points, but even if they don't, this IDEA law is going to mandate that generally every 3 years, except in certain cases, a child's going to have a reevaluation to sort of reassess where they are and what their needs are and whether they continue to be eligible for all of those same services. And so, again, this process at the very beginning, when we're talking about identifying the possible need for services, this is making that initial request. So in our case today, when we talked a little bit about the 5-year-old, it sounds like that had sort of started. So somebody had started this process with the family. And that can really be anyone. That can be the school itself. If he was attending kindergarten already and there were some concerns, the school could propose that they start the evaluation process. Parents are often the ones that make this request. And they can request an evaluation really at any time if they're starting to have concerns. It can be verbal or written. I typically suggest that it's in writing and that there's some documentation just so parents can sort of keep track of the timelines and what they've asked for. And then this can also be sort of initiated or prompted by a pediatrician, which in the case of our 30-month-old, sounds like some of the providers who have seen him in the emergency room are trying to help the family sort of initiate that process as well. And so once that referral is made, again, it's either to the early intervention system if they're under 3 or to their local public school, or in Pennsylvania, we have intermediate units that service the preschool special education. That team is going to make the determination to see if they qualify for services. And again, we've talked about the evaluation process already that they'll have to go through. Go ahead to the next slide. And now I'm going to hand things off to Katie to sort of take us through the rest of this process.
Great. Thanks, Susanna. Okay, so talking a bit about multidisciplinary evaluation. So this is how special education eligibility is determined. And then it also serves as the primary mechanism that informs the Individualized Education Program, or IEP, in terms of information about a student's strengths and needs, goals that would be appropriate for them to access the general education curriculum, related services they might benefit from, accommodations, and so on. So a multidisciplinary evaluation evaluation is going to include a number of components to ensure that based on concerns that have been expressed about the child's educational performance and other related needs, they're being fully assessed. So that would include things like a cognitive or intelligence assessment, academic assessments in terms of how they're performing in terms of what would be expected at their current grade level, behavioral assessment in terms of if they're experiencing challenges with age-appropriate behavior and across different settings, and then remaining assessments related to needs they might have with related services like occupational therapy and physical therapy, speech and language or communication. Speech and language or communication assessment might also include alternative communication if it's identified that the student might benefit from assistive and augmentative communication. So there are a number of factors that would be included here. It will often include consultation with the family to ensure that they're getting information around what's happening outside of school as well as what's happening inside of school. The psychologist would meet one-on-one with the student to conduct a number of these assessments. They would also pull information from people who know the student well. I mentioned the family, but also the teacher, the people who see the student a lot on a day-to-day basis. Next slide, please. So based on that evaluation, a determination would be made in terms of whether or not a student would qualify for special education services under the Individuals with Disabilities Education Act, whether or not they fall into one of those 13 disability identification categories under IDEA. It's important to note that a child may still have needs, but they may not necessarily fall into one of those categories. If that's the case and it isn't a fit under IDEA, then the school would also consider whether it's something that might fall under Section 504 of the Rehabilitation Act. That would enable the student to receive accommodations and even services so that they can fully access their education. But if a child is determined eligible for special education, the team would develop an individualized education program or IEP. This really then serves as the cornerstone of the child's educational experience. The primary goal here is to ensure that they're provided with free and appropriate public education. That was one of those abbreviations we had on that slide from Susanna. You'll often hear this called FAPE. That's really what underlies IDEA. Within the IEP, there are some primary things that you can expect. So you can expect to see learning goals for the child in all of their areas of need related to their education. So if a child doesn't have any needs related to reading because they're performing at the age-appropriate level and their disability is not impacting their performance, you wouldn't necessarily see reading goals. But you would generally expect, based on the student's strengths and needs that have been identified in the assessment, corresponding learning goals, again, that enable them to access and make progress in the general education curriculum for their grade level. The IEP will also state, if we could go back, the IEP will also state the services that the school will provide. So this would be things like if the student is going to receive any related services, as well as other supports, like are they going to spend time in different settings? Are they going to have pull-out supports? Do they need certain types of assistive technology? Do they need other supports when they're in or out of the classroom to fully participate? And those would also be specified as accommodations and modifications. Next slide, thanks. So the IEP team includes quite a few people. So it includes the family or guardian of the child. It always includes at least one regular or general education teacher and at least one special education teacher. The child is included when appropriate. I would argue it's always appropriate to include them in some capacity, an age-appropriate capacity. It's not mandated until the child reaches transition age, which is 16 years of age federally. In Pennsylvania, it's 14, and it varies a bit depending on states, at which point they need to at least be invited and they can make the choice as to whether or not to attend. But just thinking about for younger ages, it may still be appropriate for them to come when they're talking about some of their strengths and needs. It may be appropriate for them to come when they're talking about the goals that they're going to have. They may not sit there through all the paperwork, but ensuring that they're a driving force in the plan that's being developed around them is key. There also will always be a representative of the local education agency, or LEA. That will generally be someone at the school, like a director of special education. An individual who can interpret the evaluation results will be present. Often that's going to be the school psychologist. And then anyone else with knowledge of the child who might be important. So that if the child does have needs related to occupational therapy, that might be an occupational therapist, so on and so forth with related service providers. Okay, so in terms of the IEP development, if a child is determined to be eligible from that multidisciplinary evaluation that we mentioned, the team is going to meet within 30 days of that evaluation, and the IEP will be developed based on the strengths and needs described in the evaluation report. A draft is usually prepared in advance of the IEP meeting, but it must be reviewed and edited during the meeting. Oftentimes, families can feel as though what's being presented to them as the IEP at the meeting is set in stone. This is what the school is going to do. No, really the idea is that this is their professional input on some recommendations, but the IEP meeting is meant to be used as a time when the family provides valuable input that will inform the program, the educational program for the child. So what would you expect to see within an IEP? All of this comes from the federal policy, the Individuals with Disabilities Education Act. So you're going to see some key sections. So at the start, you'll see some general pages that might be regarded essentially as the paperwork piece. So some general information. This will list all of the child's basic information, their name, their age, their birth, the disability classification, their address, things like that. Notes are always provided on the front page about whether or not revisions have been included within the IEP in a given year. The IEP should be a living document. It is not necessarily meant to be, it is not at all meant to be written, put in a cabinet, and to stay there for the year. Students sometimes develop in ways that we might not expect or anticipate. That might include progress, that might include lack of progress, and the IEP should be revised as needed. There's a signature page that all team members sign, and then there's also the families presented with the procedural safeguards related to their rights in the special education process, and they sign a form indicating that they've received that. Moving through the IEP, then you're going to see several sections. So special considerations, a lot of these just relate to specific disability-related supports that we might anticipate, like whether or not the student needs supports related to being deaf or hard of hearing, interpretation, things like that. Also, you will see present levels of academic and functional performance. This is pulled from the evaluation report as well as data from the teacher. And others. And this outlines where the child is right now and gives that information on educational needs that will be addressed in the goals. Transition services. Similarly, I would advocate this is always appropriate. We should be thinking about transition from a child's early education. This is thinking about what they want their future to look like. It will get a lot more specific as they get older, and it is mandated to begin by the age of 14 in Pennsylvania, age 16 federally. This will include things across the key areas of employment, post-secondary education and training, and community living. There's a section on the degree to which the child will participate in state and local assessments, and appropriate accommodations and/or alternative assessments. Moving on to the next chunk, the goals and objectives. This is such a key part, and this is where I would really encourage families to speak up about what they're seeing, what they value, what they know their child values. And this will include long-term goals, and then depending on the student's level of need, if they take an alternative assessment, meaning they have more significant support needs, you would expect to see some short-term goals because we want to monitor progress a bit more closely. The next section is going to outline all of the steps the school is going to take to ensure the child will be successful in meeting these goals. These are things like program modifications and specially designed instruction, supplementary aids and services, related services like speech and language, physical therapy, occupational therapy, social work and counseling. Supports for school personnel. This is key. Maybe the classroom teachers all need to be trained on the child's AAC device. And then whether or not the child is eligible for extended school year. This is often based on whether or not significant regression would be expected over that summer break. And then lastly, that educational placement. Again, this is another important area for families to serve as advocates. This is the section that's known as the least restrictive environment. Every child has the right to be educated in their least restrictive environment, which is determined based on where they can make progress in the general education curriculum. So again, we think of the most inclusive placement as being the general education setting, and then that goes all the way to a separate school or even in-home educational setting based on the child's needs. But again, I encourage you to ask for more information, ask for the rationale behind what's being proposed as the least restrictive environment. Okay, so knowing your rights. I've described that free and appropriate public education. Your child has a right to a free and appropriate public education in the least restrictive environment, as we've outlined. The IEP is a legal document and must be followed as written. Just recently, I have a colleague who their child has a disability, and the school bus has been picking them up almost an hour late every day. That means the child's losing up to an hour of instructional time. Because transportation is included in the IEP, that means that's a violation of the services and the free and appropriate education they're entitled to. They've been documenting and tracking that so that they can be prepared to talk about it with the school when needed. It's important that when you have concerns regarding your child's IEP, you document those in writing along with the district's response when you reach out. As I've noted, as a family member or a loved one or someone who knows a child well, you are a critical part of the IEP team, and you should always have the opportunity to share your voice in developing your child's support plan. Okay, so we've got about 9 minutes.